name is Alex Merced from alexmerced.com, and what I wanted to do is talk about the price of healthcare and why the price of healthcare is so high. Because the problem is people focus on the wrong problem. They're focusing on the cost of healthcare insurance. They're focused on the accessibility of healthcare insurance, when the real issue is the cost of the healthcare service itself. Because as the cost of healthcare services go up, by virtue, the cost of healthcare insurance goes up. Now, there's a lot of history around how healthcare got to the place where it is now. So before I go into a little bit more detail, I want to suggest that you really pick up the book, The Primal Prescription by Doug McGuff and Robert Murphy. It's a great book that gets into the history of the healthcare system and really helps put it into perspective. But to me, I want to point out three particular ways that healthcare prices continue to go up. One is third-party payment. Basically, the way it works now is that your employer buys you your insurance. So basically, since a third party, your employer, is paying for another third party to pay for your healthcare costs, there's a complete disconnect between the consumer and the provider. So what happens is that when someone designs a business, when someone designs a product, they design it to the people who make the choice to pay, the people who are in control of the funds. So in this case, what happens with a lot of medical practices, a lot of the focus on how you develop a medical practice is not on necessarily making the experience better for the healthcare recipient, because they're not the one making the decision to pay, it's the insurance company. Everything is designed on making sure that the paperwork is right for the insurance company, that the insurance company is going to pay. So you end up with double booking, triple booking of appointments, because they want to make sure that there's enough billing going on, because also healthcare insurance companies take their sweet time paying for a variety of reasons, that they want to make sure there's enough money coming in to support their business. And on top of that, insurance companies don't design a product for you, they design a product for your employer. So they want to design a product that's easy to maintain, that's low cost for your employer who's making a decision which health insurance company to go with. So healthcare providers aren't designing a product for you, and health insurance aren't designing a product for you, because you're not the one making the choice. That's the power of choice. If you choose, okay, I'm going to go to this doctor or not, because you can go to whatever doctor you want because you're paying out of pocket, those doctors are going to care about how long you wait, about how happy you are with your service, about your ability to communicate with them, because they want that return business. Or even if health insurance companies, if you were directly paying for health insurance companies on a broader level, I mean, you have a limited individual market right now that's really underdeveloped, and honestly, the system is already so botched that it's kind of hard to develop it right now. But if you had a broader individual insurance market, insurance companies would develop a product that'll basically facilitated you, the consumer, more. I mean, you see that with some of the individual healthcare products that exist now. You know, for example, I'm insured by a company named Oscar, and they make it possible for me to actually call a doctor if I need one without having to make an appointment. And you don't necessarily see that with insurance that you always get through your boss, which, again, some of that stuff is changing now because there's competition and also just trying to cut costs. But a lot of that stuff would have already been in place if I could choose who my insurer was a long time ago. If I paid for my healthcare provider a long time ago. When I say me, I mean everyone. If we were all in that market environment, instead of, again, just hoping that our employer provides us with a decent insurance, and hopefully that insurance pays our doctor. So that disconnect allows prices to run away and your experience to be poor. Okay, because the products are not designed for you. And then again, doctors have to charge more to make sure that they're getting enough cash coming in, because it's all one big negotiation. Second thing is intellectual property laws. The way patent systems are now, they increase the price of drugs, because basically, and people always say, well, if you were to get rid of the patent system or reduce patent protections, people won't invest in innovation. I don't agree with that. Now, if you were to at least weaken patent protections, yes, they're not going to necessarily make as much money as they would, and they may not invest as much money into research and development. But again, it's not the absolute dollar amount, it's what those dollars buy. So all those people who produce lab equipment and whatnot, they still need to sell that stuff. So they charge what they charge now because they know people will pay for it. So they make huge profits because they know, because basically pharmaceutical companies are like, well, we can afford it because if this drug makes it through FDA and we get a patent on it, we're gonna make X number of huge profits on the other end because we'll have monopoly rights over it because of the patent, that it's fine to pay the exorbitant prices for lab equipment. That lab equipment would become a lot cheaper if that wasn't the case. So basically, if you were to reform intellectual property laws, prices of the inputs would adjust with the capital that goes in to an extent. Okay, basically prices will adjust, the industry will adjust. Okay, so I don't necessarily buy that argument, and people aren't going to sit there and think, well, if I have a great idea, I'm not going to invest in it. People have great ideas, they're going to make it happen. People make things happen in the nonprofit sector all the time. People are going to still make things happen. And the last thing that kind of really keeps driving up prices is the scarcity of supply, in the sense that we make it harder for people to become doctors, as far as creating all sorts of licensing requirements in order to provide medical services. Now, while there are some services that you're going to want someone with a high amount of credentials to do, like certain surgeries and whatnot, there are basic services that you don't necessarily need someone quite as credentialed to do. Okay, and basically by shrinking the pool of who can provide you with X, Y, and service that may save your life, you're increasing the cost of that service because you're inflating the supply, disinflating the supply. And on top of that, also limiting the number of hospitals, because you have things like certificate of need laws that limit the number of hospitals that can come up into existence. So basically, you can only create a competing hospital if all the other hospitals are okay with you competing with them. That's weird. Okay, the certificate of need laws. So you have certificate of need laws, different licensing requirements that limit the supply of available healthcare. You have intellectual property inflating the cost of a lot of your pharmaceuticals, the drugs that you need to survive unnecessarily. Again, how long you're protected under a patent is completely arbitrary. Why does it have to be so long? Doesn't necessarily need to be there at all. Okay, there is a good argument for rethinking the whole idea of intellectual property. Now, again, that's a more complicated debate. What I would refer to you is a pamphlet by Stephan Kinsella called Against IP to kind of understand more that debate and that argument. But again, we can at least reform and weaken some of those protections to limit some of the damage that does to prices. And then 3, again, getting the consumer back in the driver's seat as far as making choices about their healthcare consumption, whether it's about buying their healthcare insurance or paying doctors directly for healthcare. That will create the incentives for optimizing and also improving your healthcare experience. Okay, and really rethinking on how to make healthcare affordable. But as long as we're just focusing on how to provide everyone with insurance without thinking about who's making the decision on which insurance and who's making the decision on which providers and all these other things in the mix, we're going to continue seeing healthcare get out of control. Now, of course, you can always take steps in your life to limit your exposure by being healthy, by basically looking to things like health sharing networks, like Health Excellence Select. There's all sorts of different things you can do to sort of opt out and protect yourself, but at the end of the day, this still affects everyone. So it's something we need to have a discussion about and kind of, again, introduce market forces to where market forces are desperately needed. There's a reason why things like education and healthcare are where you see the biggest increases in prices, and the places where market forces are least present. So my name is Alex Merced from alexmerced.com. Have a great day and enjoy.